At the end of the last lecture, we were talking about unbalanced ventricular output. And we said that unbalanced ventricular output happens when the two ventricles are not putting out exactly the same volume of blood with every time the heart contracts. The volume of blood with every heartbeat is called the stroke volume, and the volume of blood per minute is the stroke volume multiplied by the heart rate, and that's going to be the cardiac output. And we said that when the two ventricles are not synchronized, that either there will be excess fluid accumulating in the lungs and the patient will be drowning, or there will be excess fluid accumulating in the legs and the abdomen, causing swollen legs or fluid in the abdomen. So the question is, how do things stay synchronized? How does everything stay balanced? And for that, we need to think about a couple of factors. And those three factors are the concepts of preload, the concept of contractility, and the concept of afterload. So let's do those individually. Preload. The concept of preload is how much pressure is filling up the chambers of the heart. You know, the ventricles of the heart and the atria of the heart, they're not the same as filling up a plastic bottle. I know, I used that analogy earlier, but they're not the same because the heart, you might fill it up with a little bit of blood and it stretches a little bit, or you might fill it up with a lot of blood and it stretches a lot. Let's imagine that instead of the ventricle, you're filling up a balloon. If you filled up a balloon with just like, I don't know, a little bit of water, and then you let it go, if you only filled it up with a little bit of water, that balloon, it might just dribble out. But if you filled it up with a hose and like, oh, you really filled it up, then when you let go, whoosh, it comes squirting out, right? The difference between a little bit in it and a lot of it is called preload. Preload is the pressure of blood returning to the heart. Increased preload will stretch the wall of the heart more, just like filling up a balloon with more water would stretch it more. And the more it stretches, the more it contracts when it's its time to contract. So that is the concept of preload. Now, contractility. In some ways, the heart is like a water balloon that you're filling up, but in other ways, it's not. The way that it's not is this term contractility. With the ventricles, if they fill up with, well, let's just say 200 milliliters of blood, then on a normal day, under normal situations, they might contract and empty themselves out by half, right? But if I gave the patient an injection of something that increases the contractility of the heart, then filling up with 200 mLs with increased contractility, instead of a stroke volume of 100 mLs, I could get a stroke volume of 150 mLs. In other words, at any given preload, I would get a greater contraction of force. And that is the concept of contractility. A good example of a drug or a hormone, both, that increases contractility is epinephrine or adrenaline. If I am suddenly terrified, then with the same amount of blood going back to my heart, but I'm terrified, so lots of epinephrine, my heart won't just like be mellow like it is right now. It'll be like boom, a boom, a boom. And we've all felt that, right? If someone startles you, all of a sudden your heart's just beating really hard. That epinephrine increased the contractility of the heart. The last concept is not exactly talking about the heart itself. It's talking about the amount of pressure there is in the major arteries. Let's just think about in the aorta, called afterload. We've been thinking about the heart as if the heart is filling up with blood and then squirting, and as if that blood's just squirting on out into space. But in real life, it's not squirting out into space. The left ventricle, for example, is pushing blood into the aorta. Afterload is how hard is the blood in the aorta resisting new blood coming in. In your lab, you probably have memorized a little bit about blood pressure, so you know that normal blood pressure is like maybe 120 over 70. So normally, the afterload in the aorta is 70 millimeters of mercury. So if the heart wants to push blood out, it only has to push out about 70 millimeters of mercury pressure, and it'll start to move the blood out. But if you've got high blood pressure, it's pushing back harder, and it's harder for the heart to empty itself. Let's talk about these in detail. Oops, not sure what happened there. There we go. Let's talk about preload. I've got a little happy daisy on preload because in general, more preload is better for the performance of the heart. When there are medical problems related to preload, it's generally due to not enough preload. All right. So preload, it is the degree of stretch on the heart before it contracts. And I was talking about how much you fill up a water balloon with water, right? If I've got a balloon here, I'm ready to fill it up with water. If I fill it up with a little bit of water, then when I let go, it'll maybe loop out a little bit of water. But if I fill it up with a lot, that would be a lot of preload. And with a lot of preload, when I let go, it goes, okay? Same thing with the heart. The preload, the degree of stretch on the heart, is the amount of pressure in the major veins that are loading up the atrium so the atrium can load up the ventricle. Greater preload increases the force of contraction. And for those of you who are going into PA school or medical school or nursing programs, you would be wise to actually remember this term. You don't have to actually know it for my exam, but you are going to want to know it if you're going into a medical clinical program. The Frank-Starling law of the heart. The Frank-Starling law of the heart really is the more you stretch the wall of the heart, the harder it will contract the next time it contracts. So the more the heart fills with blood during diastole, the bigger it got, the greater the force of contraction during the systole. A fancy way to say that is that preload is proportional to end diastolic volume. The Frank-Starling law of the heart is the reason why we will give a patient IV fluids when they are dehydrated. It's the reason that we will give a patient blood if they've lost a lot of blood in, for example, a car accident. We are giving patients those fluids into their veins to increase their preload. In not enough preload, inadequate preload, is the biggest reason why patients will go into shock. And giving them fluids will bring them out of shock. Sometimes a patient with the stomach flu will have lost so much body fluid, like he's lost 10 pounds because he's lost so much water. Well, that has decreased his blood volume, and that has a chance of decreasing the preload. If a patient gets dehydrated enough, their heart quits working right. Why? Because of Frank-Starling law of the heart. They didn't have enough blood volume, so they had not enough preload, so that every time their ventricles filled up, it just filled up a little bit. So every time their ventricles contracted, they contracted a little bit. So they were getting little spits of blood coming out of the ventricle into the aorta, not enough to keep the patient conscious, and you end up with shock. Contractility. Contractility, if you've got any given amount of expansion of the heart, like over here, I've got 200 mLs in my ventricle. Over here, I've got 200 mLs in my ventricle. But in this one, I've got normal contractility. In this one, I've got good contractility, better contractility. Increased contractility will increase the amount of contraction at any given preload, 200 mLs, 200 mLs. With normal day-to-day contractility, 200 mLs cause the heart to spit out 100. if I give a patient epinephrine, 200 mLs of preload causes it to spit out 150, okay? So agents that will increase the contractility of the heart are called positive inotrope or positive inotropic agents. And we will give a patient that's in shock positive inotropes like epinephrine or another one called digitalis. And we do that until we can get their preload back up and until we can get their heart functioning again. If a patient's got blood pressure that's too high, they've got hypertension, we will give them negative tropes. So if their heart fills up with 200 mLs, we will cause their heart to mellow out, don't contract so hard, and that will help bring their blood pressure back down. Afterload. Afterload is the amount of pressure in the arteries that has to be overcome before the ventricle can even move 1 milliliter outward. Let me give you an example of that, okay? So let's imagine that I am blood and I want to leave the ventricle. Now I'm blood and I'm ready to leave the ventricle. So I am pushing on that door, right? And what is pushing back? What's pushing back on me is blood pressure. You know, whatever your blood pressure is, 110/60 or 180/90, whatever is pushing back, that's what's pushing back at the door. So when the ventricle starts to contract, oh, the ventricle is contracting. I'm trying to push my way out. But if the pressure inside of here is 90, but the pressure out there is 100, I'm pushing against that door, but nothing's moving, okay? So afterload is basically your blood pressure. Afterload in the systemic circulation is different from afterload in the pulmonary circulation, but it's basically the blood pressure in that main artery. And if that pressure goes way up, then it's harder and harder for the heart to push out even a drop of blood. The biggest problem with afterload is high blood pressure or hypertension. Hypertension makes it so that just to move, like when you're healthy and your blood pressure is normal, your heart doesn't have to work hard at all to eject 100 milliliters of blood. Your heart's like, I can do that all day and into the night. But when your blood pressure goes crazy high, then your heart has to work twice as hard to move less blood because it's pushing against afterload. I've got a sad face on afterload because afterload's a problem when there's too much afterload. All right, we will start there at the next video.